Navigating the maze of child development, you're seeking answers. You're wondering, at what age do ADHD symptoms typically appear? It's no small question, and it's important you're asking. Understanding the onset of ADHD can be your roadmap to early intervention, helping you guide those you serve towards successful strategies. Let's dive into the complexities of the diagnosis, the subtleties of symptoms, and begin this journey of knowledge together. Understanding ADHD, or attention deficit hyperactivity disorder, begins with recognizing it's not just a childhood condition, but a neurodevelopmental challenge that can impact individuals during young adulthood and beyond. What do we mean when we say ADHD is a neurodevelopmental challenge? A typically developed brain works to assimilate and organize information so meaning is formed and action is taken to achieve an outcome. When there is a neurodevelopmental challenge, the brain struggles to move between the different thoughts and activities as quickly and efficiently as an individual with more typical brain development. This creates unique challenges with organizing information, knowing how and when to have a conversation, and managing anxiety when stress increases and overwhelms young adults living with ADHD. That goes to say that ADHD is not to be understood as a character issue that automatically means an individual is lazy or stupid, nor does it mean that individuals automatically grow out of it when they start their young adult lives. No. The neurodevelopmental challenges means launching into adulthood may include challenges with growing self-supportive skills. Understanding this truth about individuals living with ADHD can dissolve the misconception that ADHD is a character issue that requires an individual to simply grow out of it, now that they are chronologically an adult. In fact, genetic influences play a significant part in ADHD, with research showing a strong hereditary component. This isn't to say that environment and lifestyle don't impact ADHD. They do. However, understanding the genetic connection helps us better comprehend why some people are more prone to ADHD. An educated look at ADHD highlights the condition's complexity and importance of early detection and management, and your role in providing supporting to those who are affected is crucial. So recognizing early ADHD symptoms can be a game changer, as it can lead you to seek timely intervention and management strategies. However, misinterpreting symptoms and ADHD misconceptions can often hinder this crucial process. It's essential to understand that ADHD symptoms aren't just about being hyperactive or impulsive. Other less obvious signs, such as difficulty focusing, disorganization, and forgetfulness, can also indicate ADHD. You might perceive these symptoms as normal behavior. Sure, who doesn't have difficulty focusing? Who doesn't feel disorganized? Who doesn't forget things? What's the difference with an individual living with ADHD? The challenge with focusing, disorganization, and forgetfulness is much more magnified and consistently disruptive and overwhelming to an individual's daily experience. Normalizing the more subtle symptoms contributes to the misinterpretation. Remember, knowledge is power. By debunking ADHD misconceptions, you're better equipped to identify and respond to these symptoms effectively. This proactive approach can make a big difference in managing ADHD. Understanding the age at which ADHD symptoms first appear is crucial for early intervention. Symptoms typically start to manifest between ages 3 and 6. However, this age of onset may vary due to factors like genetic influences and cultural differences. Here are some key points to note. Genetic influences. If a child's parents or siblings have ADHD, they're more likely to develop it. There is even greater chance of developing ADHD when both parents live with the condition adverse to one of the parents. Cultural differences. Attitudes toward behavior and attention can vary between cultures, affecting diagnosis rates. Early onset. Some kids show signs as early as 3 years old, but symptoms show up before age 12. Late onset. In rare cases, symptoms might not become apparent until adulthood. Serving others means understanding these nuances so you can provide the best support possible. Next, we'll explore managing ADHD through early intervention strategies. Early intervention is key to effectively managing ADHD symptoms. A multifaceted approach that includes behavioral techniques and ADHD nutrition can significantly enhance an individual's quality of life. Understanding and implementing these strategies early on can lead to better long-term outcomes for those with ADHD. Consider these early intervention strategies. Consulting your primary care physician. First, make an appointment and discuss your observations or symptoms with your doctor. Allow your doctor to assist with determining if a medical explanation exists that explains the symptoms and if the medical condition needs treatment. If a medical condition is ruled out, allow your doctor to recommend testing with a psychologist to determine if a diagnosis is warranted, plus any accompanying learning disabilities and/or mental health diagnoses. Pending the results of the testing that confirms a diagnosis, your doctor may recommend one or more of the following. For instance, a psychiatrist. Primary care physicians may assist with treating ADHD with psychostimulant medication. However, if the nature of the treatment is more complex, the primary care physician may refer you to a psychiatrist in order to treat the condition more thoroughly and effectively. Remember, psychotropic medications are one tool used to treat ADHD, and the pill doesn't give the skill. That's why comprehensive treatment also includes the following: behavioral techniques. Cognitive behavioral therapy, or CBT, may help with managing emotions, behaviors, and increase coping. ADHD life coaching. Life coaching is an adjunct to treatment given by a physician and/or therapist. Life coaching can be supportive and work to help an individual identify and achieve practical goals that are achievable and at a pace the individual can do. However, meaningful progress doesn't typically occur when untreated ADHD or other mental health diagnoses are getting in the way. ADHD nutrition, a balanced diet rich in omega-3 fatty acids, protein, and complex carbohydrates can help manage ADHD symptoms, but doesn't replace a supportive network required for daily living. Physical activity. Regular exercise can help to improve concentration and reduce impulsivity. Consistent routine. Providing a structured daily routine can help an individual feel more secure and less anxious. Supportive network. Doctors, therapists, life coaches, family and friends who are educated and understand how ADHD shows up with an individual is crucial for overcoming challenges and achieving meaningful gains. Please remember, no matter the age, it's never too late to start getting support.